I'm Kristi Hesse, and I'm a doctor of audiology at Arizona Hearing Specialists, and I work in the La Cholla office. Today I'm going to talk to you a little bit about different styles of hearing aids. There are several different styles, and sometimes it can be a little bit overwhelming. So we're just going to talk about the benefits of certain styles. So one style that people oftentimes come in thinking would be a good choice for them is what's called the completely in-the-canal hearing aid. So this is one of the smaller styles of hearing aids, and when it's in your ear, you essentially can't see it. It depends on your hearing loss whether or not this is a good choice for you, and if your hearing loss is appropriate for this hearing aid, there are certain drawbacks. It is the smallest, so it does fit rather deep in your ear, so when you're putting it in your ear, you run the risk of pushing any wax or debris into the receiver of the hearing aid. So typically there are a few more repairs with this style of hearing aid. You also can run the risk of having damage to the shell, and that goes with any in-the-ear style hearing aid, and they can be expensive to have the shell repaired if they're out of warranty. However, if you're looking for an option that's not real noticeable to people, this is a great option if it's appropriate for your hearing loss. There are two other in-the-ear style hearing aids. One is called an in-the-canal, and the other is called an in-the-ear. An in-the-ear hearing aid is going to fill up the outer portion of your ear, so it's a little bit more noticeable, and an in-the-canal style hearing aid is going to fill out just the bottom portion of your ear, so not quite as noticeable. Many of the same advantages apply to all three of the in-the-ear styles. They are somewhat simple to get in, just one move to get the hearing aid in your ear. But again, because all of the components are sitting in your ear, with all three styles you do run the risk of getting wax into the hearing aids. The other disadvantage of having to repair the entire shell also still exists. The other thing to keep in mind is in-the-ear hearing aids are not always appropriate for your hearing loss because sometimes you don't want to plug up the ear. If you need an option where you're not plugging up the ear, then you're going to want to consider a behind-the-ear option. So there is the traditional behind-the-ear hearing aid that has what we call an ear mold. The ear mold is just a clear or colored piece of plastic that sits in your ear to funnel the sound to your eardrum. There's no components in this piece, so if you're a person who builds up a lot of wax, it's a good option because it's not as likely to be damaged. This is another style that's rather popular these days, and it's called a receiver in the ear style, or an open fit hearing aid. With this style of hearing aid, you can see that there isn't a customized mold for the ear. There's just a little plastic dome on the tip. These hearing aids are only appropriate for people who have normal or near normal low frequency hearing loss. If you have low frequency hearing loss, then you would need a style that closes the ear off more. You can still get the benefit of a skinny tube style behind the ear hearing aid, but if you have low frequency hearing loss, you would need a customized tip on the end.